Okay, so welcome to week 2. Today we are diving into chapter 6, the musculoskeletal system. As you can see, if you have this compound construction of the title, musculo, which means muscle, plus skelet, which means skeleton, plus al, al, which means pertaining to. So right there is telling you what musculoskeletal is. Let's dive in. Our core goals for this chapter are threefold. First, to understand the system functions. Second, master the combining forms for basic anatomical structures. And finally, learn how to build and dissect terms relating to pathologies, diagnostic tests, and surgical interventions. So let's jump right into the anatomy and function. Before we look at the words, let's look at this system. Beyond protection, support, and movement, there are two functions students, or I may even forget, and that is hematopoiesis and storage. Let's break down hematopoiesis. So, hemato, which means blood. The suffix poiesis means formation or production. So it literally translates into the production of blood cells, and this occurs in the red bone marrow. So take a look at an anatomical overview. In a medical terminology course, you aren't just learning where these bones are, you're learning their formal names, which serve as the word roots for medical procedures. For examples, looking at kneecap, the patella, if a surgeon performs a patellectomy, that is patella with ectomy, the surgical removal of the kneecap. So some word breakdown is you have cranio, which is skull, craniotomy, a surgical procedure in which the neurosurgeon temporarily removes a section of the skull called the bone flap, usually to remove a tumor or a clot. Costo, which is rib. Notice the common name is costa. If a patient has pain between their ribs, it's called intercostal pain. Inter meaning between. Spondyle versus vertebra, both meaning vertebra. Usually spondyle is used to describe diseases like spondylitis, where vertebro is used for anatomical descriptions like vertebral column. Note that the region of the spine, cervical, the neck, or thoracic, upper back and chest, and lumbo, lower back, reminding that cervico can mean neck of the body or the cervix, neck of the uterus, depending on the context in which it's being used. Here is a lateral view of the cranium. Note the mandible, the lower jaw, or the maxilla, which is the upper jaw. So the lines connecting these bones are called sutures. In newborns, these joints are immovable but flexible, allowing the skull to pass through the birth canal. This slide shows the ribs, costo, and the breastbone, sterno. Anatomical highlight, which is to note that the tip of the sternum, called the xiphoid process, the word xiph means sword, describing its sharp, pointed shape. And also note the costal cartilage, chondro, connecting the ribs to the sternum. So carpal refers to the wrist. Think of carpal tunnel syndrome. Phalangio refers to phalanges. So remember that phalangio stands for the bones of both the fingers and the toes. And you must look at the surrounding context of the medical report to know which limb is being discussed. So this is just more anatomy. So the pelvis is made of fused bones, each with its own combining form. Look closely at ilium and the root word ilio. This is spelled with an I. Later in the semester, when we cover the digestive system, you will see an E, ileum with an E, and this is part of the small intestine. So they sound identical. Just remember the I for ileum relates to the iliac crest bone, which is in the pelvis. So we'll break down some terms of the foot bones. Femur, thigh bone, the largest bone in the body. Tibia is your shin bone, and fibula is the smaller lateral lower leg bone. A memory trick may be a little fib is a small lie. The fibula is the smaller bone. Calcine or calcineo refers specifically to the heel bone, calcaneus. And here's just some visuals. Here's a knowledge check. These are crucial prefixes, suffixes, and roots that modify our skeletal terms. Anklo means stiff or crooked. If a joint is permanently stiffened, it is ankylosed or ankylosed. Asthenia means weakness. For example, myasthenias gravis. Myasthenias means muscle weakness. Sarcoma means a malignant tumor or connective tissue. A cancer originating in the bone is in osteosarcoma. So we can differentiate soft tissue elements. Cartilage, chondro, is cushion joints. Tendons, tendo, attach muscle to bone. Fascia is the fibrous membrane wrapping around the muscle fibers like a sleeve. Articulation is simply the medical term for a joint. Synovial joints are fluid-filled, freely moving joints. Bursa or burso are fluid-filled sacs that act as friction reducers. If they get inflamed from repetitive motion, a patient develops bursitis. Ligaments, which we will continue to talk about, are bone on bone. So here's a knowledge check. And time for a brain break. Once again, get up, move away from your computer, get a snack, move around. Let's take a quick look at the muscular side of the system. We have three distinct types of muscle: cardiac, which is involuntary, striated, and involves the heart walls; skeletal, which is voluntary, striated, and moves our bones; and smooth, which is involuntary, non-striated, and lines hollow organs. Kinesiology terms are vital for charting physical therapy or orthopedic notes. Flexion is decreasing the angle of a joint, bending. Extension is increasing the angle of a joint, straightening. Abduction, moving a limb away from the midline. A memory trick is to abduct someone is to take them away. Adduction, moving a limb toward the midline. Memory trick, you are adding it back to the body. We're now moving on to pathology. This is where your word building skills will continue to grow. So review these terms carefully. If you know that osteo is bone and malacia is softening, you don't need to memorize what osteomalacia means. You can just decipher it right off the page. If you know that tendo means tendon and itis means inflammation, you easily understand that tendinitis means inflammation of the tendon. So osteoporosis is osteo, bone, plus porosis, Porous or passage, literally meaning porous bones. Osteomalacia, which we talked about earlier, is osteobone plus malacia softening, which is softening of bones due to vitamin D tissues. Osteomyelitis is osteobone plus myelo, root for bone marrow or spinal cord, plus itis, inflammation. This is an infection that has penetrated deep into the bone marrow. Let's look at some trauma terminology. An open fracture means the bone has broken through the skin barrier, high risk for osteomyelitis. A closed fracture stays beneath the skin. A sprain is an injury to a ligament or joint. A strain is an injury to a muscle or tendon. A little memory trick may be that remember the T in strain and associate that with tendon. So these are terms dealing with general joint pathologies. Arthropathy, which is arthro, joint, plus pathy, which is disease, any disease of the joint. Polyarthritis, poly meaning many or five or more, and arthro meaning joint, and itis is inflammation. Arthralgia, which is arthro, joint, plus algia, pain, joint pain without explicit inflammation. Osteoarthritis, wear and tear arthritis, is a degeneration of the articular cartilage. Rheumatoid arthritis is an autoimmune attack on the synovial membrane, and gout is a metabolic arthritis caused by uric and crystals settling in a joint, typically in the big toe. So myasthenia gravis is which is muscle, plus asthenia, which is weakness, and gravis, which means severe. It's a severe autoimmune muscle weakness disease. Sarcopenia, which is sarco, flesh muscle, plus penia, which is deficiency or lack. This is the natural loss of muscle mass as we age. So scoliosis is the abnormal lateral C or S-shaped curvature. Kyphosis is exaggerated thoracic curvature, and some people refer to hunchback, but that's not appropriate. And lordosis is not on here, but it is the exaggerated lumbar curve or sway back. Here's a little knowledge check for you. So now we're getting into the final section, which covers healthcare providers' diagnosis and treatments. So looking at we covered this earlier, but ortho meaning straight and pedo meaning child. So historically, this specialty began as a way to straighten structural deformities in growing children, hence the connection there. And today it treats the entire musculoskeletal system across all age groups. When a bone breaks, it must be put back into place. So this is called a reduction. A clinical distinction is a closed reduction means the doctor manipulates the bone back into place from the outside. An open reduction requires an incision or surgery to physically realign the bones, usually utilizing internal fixation like plates or screws. Hence, you will hear ORIF, ORIF in the hospital, which means open reduction internal fixation. Let's dissect surgical suffixes. Remember, ectomy equals removal. Tomy is incision or into. Plasty equals surgical or repair. So osteoectomy is removal of bone. Chondrectomy is removal of cartilage. Craniectomy versus craniotomy. In a craniotomy, the surgeon cuts a bone flap, assesses the brain, and replaces the bone. In a craniectomy, the bone flap is left off temporarily to allow swelling brain room to expand. So, tendoplasty is a surgical repair of a tendon. Myoplasty is surgical repair of a muscle. Laminectomy is the removal of the lamina, the back arch of the vertebrae, to give pinched spinal nerves breathing room. So, arthrocentesis, which is arthro, joint, plus centesis, surgical puncture to withdraw fluid. This is done to drain fluid out of a swollen knee or pull a sample to test for infection. Arthroscopy, which is arthro, joint, plus scopy, visual examination with a scope, as seen on this slide. This allows a surgeon to see inside a joint using tiny incisions. And here we go. So some of the pharmacology is you have anti-osteoporotics, which is anti against osteo bone, plus porosis, which is porous. It's essentially against porous bones, medication to treat that. NSAIDs are non-steroidal anti-inflammatory drugs. And the suffix inflammatory meaning they actively work against the inflammatory process, itis, in the joints. DMARDs, or disease modifying anti-rheumatic drugs, are used for autoimmune forms of arthritis like rheumatoid arthritis. So here's a final knowledge check for you. And so thank you to everyone. You've gotten through week 1 and we're on to week 2. Please make sure to use the resources to reinforce the knowledge you're learning in Brightspace and also in the Google Notebook. And reach out to me if you need some additional resources.